As the number of coronavirus cases continues to balloon across the nation, more governors are now issuing statewide stay-at-home orders. Among them, Florida. Governor Ron DeSantis, his state ranks 5th in terms of the number of confirmed cases here in the U.S. But as the cases mounted and the death toll ticked up in Florida, DeSantis resisted calls from public health experts to issue the order. It wasn't until that phone call with President Trump yesterday and also more than 3,000 new cases over the last 3 days did the governor heed their calls. Right now, there are nearly 8,000 cases and at least 100 deaths, and we're still hours from the order taking effect. It's set for midnight tonight. The governor previously said he was waiting for directives from the federal government, which prompted this response from the U.S. Surgeon General.
My advice to America would be that these guidelines are a national stay-at-home order. They're guidelines that say that, look, the more we social distance, the more we stay at home, the less spread of disease there will be.
Governor, was it the Surgeon General's comments earlier today that shifted your thinking on a statewide stay-at-home order?
No, because I had decided on this, when the president did the 30-day extension, to me, that was, people aren't just going to go back to work. That's a national pause button. I had concerns about how some of that would affect different communities in Florida who have not been hit the same way, and I don't anticipate getting hit the same way as places like Miami-Dade. But I wanted to see what their guidelines would actually say, and even the guidelines, they never actually said to do that. The Surgeon General, U.S. Surgeon General, never told me that that's what they were looking for. But I think that given that we're having a 30-day, I think that's a signal from the president that, look, this is what we're going to be fighting for a month.
Okay, that decision from the Florida governor is likely welcome news for former Food and Drug Administration Commissioner Dr. Scott Gottlieb, who yesterday expressed optimism that the U.S. can avoid the striking coronavirus death toll projected by the White House if states like Texas and Florida act.
I think the real wild card here and the decision point on whether or not we're going to have the bad outcome that Dr. Fauci and Dr. Birx talked about is what populous states like Texas and Florida do that really haven't taken aggressive steps. Even now, they're large states. They have large urban areas that have very dense populations. And if they don't get more aggressive, then we could be on the cusp of some of those bad outcomes. I think if those states start to act very aggressively right now, we could keep this hopefully well below those kinds of models.
Need Cuomo.
Mississippi and Georgia have also issued statewide stay-at-home orders. The order from Mississippi comes more than a week after the governor superseded local efforts in his state to promote social distancing. According to state data gathered by the COVID Project, Mississippi has the highest hospitalization rate from the virus in the country.
Let's just up there for a second. Mississippi has the highest COVID-19 hospital rate in the country. Jonathan Lemire, let's bring you in. Also, Jim Vandehei with us as well. Jonathan, this is actually a governor who is contemptuous just a week ago of these stay-at-home orders. He, in fact, undercut some local officials who had stay-at-home orders to try to protect people in their towns and their cities. And he said wanted people to pray for him, but was going to continue to be reckless. It's like, drinking on a Saturday night and then saying, hey, everybody pray for me tomorrow morning in church. Now, that doesn't really help. Don't drink on Saturday night, and you'll be much better, getting to church on Sunday morning. But this guy was like, pray for us, but I'm not going to do anything. In fact, I'm going to ignore healthcare officials and everything they're begging me to do. I'm not going to even let my local mayors do what they're trying to do to save people in their town. And now, look what's happening in Mississippi. All too predictable.
Right, the number of cases there have exploded. We finally saw yesterday, Florida, Governor DeSantis acted. I know this show in particular has been championing for that for quite some time. You know, there are images even this weekend of beaches up in Duval County near Jacksonville where you could see the line, which counties had closed the beaches and which counties had not. And those that didn't, the beaches were still packed with people. Obviously, a real risk to spreading this virus. There are still a number of states, of course, that don't have this. I believe Alabama is now surrounded by states that have stay-at-home orders, but it does not. And they don't expect there to be a federal guideline on this. The president was asked about this yesterday. He was pressed on it in the White House briefing, and he said that he wanted to continue to defer to the states. He and the vice president, they said, well, they believe in federalism, that the state's governors should make their own decisions, and that the White House, at least for now, was not going to impose a national stay-at-home order, even though there is mounting pressure, even from within the own administration, from Dr. Fauci, from Dr. Birx, behind closed doors, suggesting that is what is needed right now. Because, as we've been documenting, right now, yes, the hot spots are in a lot of these big cities on the coasts, but they're spreading. And they're eventually will head to states that don't have the medical capabilities, the healthcare capabilities that, say, New York City does. New York City's hospitals are overrun right now. There's no question. But there is at least the capacity to handle an influx of people. Other states, less density, sure, but also perhaps doesn't have the adequate healthcare system for the influx of patients that are surely coming. But at least for now, the president continues to want to put the onus on the states. We saw that in terms of medical equipment, his slowness to invoke the Defense Production Act. He still wants the states to be responsible to find respirators, to find masks, and at least now, even though the president extended the stay-at-home guidelines suggestions through April 30th, there doesn't seem to be an order coming from Washington that will require all citizens to follow.
So the problem with that, Mika, is, of course, that people travel across state lines. And as you travel across state lines, you take the virus with you and you affect other people in new states. Also, the president we've talked about this for a very long time, the president relying on 50 governors, it's a patchwork approach and it doesn't make any sense. And, you know, it was the president who got the intel briefings in January warning him.
Right.
It wasn't governors, it wasn't Governor Tate. It was the president that got the warnings back in January. It was a president who has actually a Secretary of Health and Human Services that tried to talk to him starting in early January, and the president went and talked to him for 2 weeks about the coronavirus, and when he did, all he wanted to do was talk about vaping. But the president had everybody around him in the White House in January warning him about this, and he kept ignoring it, of course, and said, I'm going to push it off to the states. Well, there's not a state approach to a pandemic. It's a national crisis. That pandemic sweeps across county lines. It sweeps across state lines. It infects people, whether they're Republicans or Democrats, whether they're in red states or blue states. And taking this piecemeal patchwork approach to a pandemic just doesn't work. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.